Welcome back to West Texas View.
This has been so interesting talking to Dr. Joy Anderson about some topics that usually we don't like to talk about. It's something that we just as soon put off. But when you've got a little girl or a little boy who are depending on you to get the right answers and to do the right thing, then you need the right answers. And that's why we asked Dr. Joy Anderson, who is an MD, gynecologist with the Texas Tech Physicians, and also a teacher in the medical school. And I wanted us to talk this section about emergency contraception blocks.
It's kind of a complicated issue because there's some controversy about this too. Frankly, I don't understand the controversy because emergency birth control is exactly that. It's birth control. It's not going to create an abortion or cause an abortion of a embryo that's implanted, or potentially even an embryo that's been fertilized.
This stops the conceiving.
Yes. Sperm live for several days. The egg only lives for one. And the majority of pregnancies happen when there's already sperm in the genital tract. And so a woman doesn't have to be right on ovulation to get pregnant. She can have sex a day or two before, or potentially even 3 days before she ovulates. The way that birth control works is it prevents ovulation and then also makes the uterus a hostile environment to sperm. It changes the cervical mucus, makes the lining of the uterus really thin, which is also why it prevents cancer. But that being said, it prevents fertilization because the eggs, or the sperm die rather. The sperm die is the primary mechanism of action. Emergency contraception works the same way. It's basically a big dose of birth control pills that we can give someone that prevents fertilization. It prevents the egg from being released if you're at the right time for it to be released, and it acts as a spermicide because it makes the uterus and the cervix a hostile environment to sperm. That is one of the mechanisms of action. If you took it and you were pregnant, it would not cause an abortion. It would not hurt the baby. It wouldn't do anything to the pregnancy, although there's a 50-50 chance of miscarriage really early anyway. And so a lot of people think, oh, it happened because I was on the pill or something like that. But emergency contraception is something every woman should know about. We like to give it immediately after unprotected sex, as soon as we can get it afterwards. And I'm kind of a cynic. Anytime I see somebody that declines birth control pills or some sort of contraception, I always make them listen to my little 5-minute spiel about emergency contraception. You can get emergency contraception behind the counter, or you can get it by a prescription. So you can go to the pharmacist and ask for it. Heads up, some pharmacies have issues with birth control pills and have a misunderstanding of how emergency contraception works. And so they do have an ability to say, I don't want to give that drug. They can also decline to give Lortab or Percocet if they think the patient's a drug addict. Pharmacists have that ethical right. But emergency contraception can be given by prescription or behind the counter. And you don't need to show an ID or anything. You just go and you ask for it. There's a certain age where you need a prescription, but we will always call that in at Texas Tech. You can call 640-4000, which is Medical Center Hospital number, and ask to talk to the OBGYN doctor on call with Texas Tech. We will call that in for you. Now, the residents may be killing me in a couple of weeks when we get 100 phone calls. Hopefully the people will have an advantage of thinking ahead and getting a prescription for this, or getting it over the counter or behind the counter before this happens. It can be taken up to 5 to 7 days out. The best time is to take it one day after intercourse or even less. So the condom breaks, you have unprotected sex, you get emergency contraception immediately. It works very well, very, very well. Much better than pulling out, or much better. I've had some patients that say that they douche to prevent pregnancy, which is laughable.
But how many hours or so does it work? I mean, like if you had unprotected sex at 8 o'clock, then how long would you have before you had to take that?
Up to 5 days.
Whoa.
Up to 5 days.
Oh, okay.
So up to 5 days is a long time. There's also something we can do called a IUD insertion. There's a method of birth control called a Paragard intrauterine device that we can insert up to 7 days out from unprotected intercourse. And that can have a mechanism of action of making the uterus a hostile environment. It's a great method of birth control, though. So for someone who says, oh my gosh, the condom broke, I never want to I don't want to go through this again. I don't want any more kids. I've done that. It was just an error in judgment, or the condom broke. An IUD is a great option for those women, and it gives them birth control too for the next 10 years.
But you know, it seems to me that every woman or every every parent should take their daughters to hear this from a doctor, so that they know what they need to do to take care of their own health in that area.
Absolutely, and that's the reason why I'm reaching out here, because I think the problem is the mothers don't know. The mothers don't know that this is available for their daughters, and it's something that we can give. It's very easy to get that prescription by calling that number. You know, there's actually a 1-800 number I believe you can call too that has that, but Texas Tech will always call it in.
And before some mother says she's trying to counteract what I'm training my daughter, what you're trying to do is to get your daughter to talk.
Yes.
And talk to her, to a parent.
And what I'm not mentioning is that frequently there's the come to Jesus moment that I have over the phone with the patient. So, and it's a quiet come to Jesus moment, but it's a moment of, you know, come on, you're not making some good decisions for yourself. Let's talk about how to take care of yourself better. And it's also opening a door for us to follow up with them and say, well, you need to be seen after the plan B is given, and we should follow up with you in a week or two. And again, another opportunity to talk about safe sex, another opportunity to talk about caring for yourself and making the right decision, because having sex is a big decision.
And what makes you feel inclined to have to do that?
Right.
Instead of
there's a lot of spine transplants, I say, with my patients, where I give them a dose of spine too. So there is something to be said for that also.
But so is that? Do you think that that's the greatest problem you have from the standpoint of the teenagers? Because you said earlier that the adolescent population was your favorite to deal with.
The ones that come and see me are not the problem. The ones that scare me the most are the ones that come in wanting a baby at 15 or 16 by choice. So that's a little bit of a population that I don't know how to help them. So when it's an unwanted pregnancy, when it's a pregnancy they want to avoid, I can help that. Giving her the opportunity to see that there's more to life than getting pregnant at 15, that's a bigger problem.
And that they have a responsibility to that child, and they cannot carry it out as a child themselves.
Yes, and there's risks to being pregnant at 15. That's not a healthy age. There's much higher rates of preterm delivery, problems with the baby, things that she could have prevented. You know, I bet the majority of them aren't on prenatal vitamins when they conceive. You know, the majority of my adult women aren't. So certainly the majority of my teenagers aren't able to think that far ahead.
Well, in our last few seconds, talk about how people can access you. The phone number across the screen is really important, and or just look in the phone directory, Texas Tech Physicians of the Permian Basin. We'll see you next Sunday with another program. Thank you so much for joining us today.
Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB-TV and KWES-TV.